Hi there, this is Dr. Aruna Tummala from Trinergy Health Holistic Psychiatry Clinic in New Berlin, Wisconsin. And I have the pleasure of introducing Dr. Anju Usman, who is actually a featured speaker and faculty member for MAPS, which is the Medical Academy of Pediatrics and Special Needs. MAPS was founded in 2006, 2007, I believe, with the prime purpose of looking at the root causes of conditions like autism and neurodevelopmental diseases, which were beginning to explode in our population. And so Dr. Usman, with other core members, I was telling Dr. Usman that I think of her as the founding mother of this organization, and they've done a lot of incredible work. I'm learning so much about the nitty-gritties of how to get children and adults with autism and neurodevelopmental diseases get to an optimal state of metabolic functioning, because ultimately it is about their metabolic functioning.
Right.
Dr. Usman has a long list of credentials, so I need this book.
So you don't have to read all of it, though.
I'll tell the main things. So you are the Chief Science Officer for True Healing Naturals, and you specialize in biomedical interventions for children with ADD, autism, PANDAS, PANS, which is the infectious component to autism and OCD, Down syndrome and related disorders. And you also serve on the board for the Neuroimmune Foundation and the medical advisory boards for TACA, which is the Autism Community in Action, Autism Hope Alliance, as well as faculty for MAPS, which is the Medical Academy of Pediatric Special Needs. And so with that, so let me ask you, why are you doing what you do?
You know, when you think about your life, you think about how did I get from point A to point Z, and I would have never thought that I would be here sitting. I'm from India. I was born in India, and I always followed rules, and I did what I was supposed to do.
So you were the good little girl.
Yes, and my parents wanted me to become a doctor. I became a doctor. I had some reasons I wanted to, but then I had 4 children, and 3 of my children had a lot of medical issues, ranging from things like type 1 diabetes, allergies, asthma, multiple chemical sensitivities, arthritis. And so I had to kind of figure out and make a kind of a U-turn on what I was doing.
Because even though you were a physician, what you were being taught in medical school was not really helping the problems that your children were facing.
Exactly. Yeah, I was in residency at Cook County Hospital in the inner city in Chicago, taking care of the sickest patients, and I had my own sick children, and nobody knew how to help me take care of them. And so this was in 1991, before the internet, before now we can talk to people and you can Google things, and back then my daughter was severely allergic to everything, pretty much. When I say everything, I mean everything. And
the stress of it.
She was dairy-free, gluten-free, egg-free, nut-free, peanut-free, all kinds of things. And so we had to kind of figure out how to do things. And then as a physician, I started treating patients, and I thought I was writing prescriptions for ADD meds. I was writing prescriptions for SSRIs like Prozac for young children.
Yes.
And I was writing for prescriptions for antibiotics over and over again. And I thought, what is going on here?
That right there is the gut-brain connection, right? If you're prescribing antibiotics for something in the body, it destroys the microbiome, and within months or a couple years, you will be writing out the prescription for Prozac.
But as physicians, we never learned that, right?
Yeah.
We say, okay, you got a strep. Well, yeah, you've got an infection. Let me treat you with an antibiotic. But we don't talk about the ramifications of that.
Yes.
And the ramifications of that are so severe. The minute you take that antibiotic, you kill certain bacteria that allow yeast and Clostridia and other bacteria to grow. You lose things like lactobacillus that help with GABA and that help with anxiety.
Yes.
You lose certain bacteria that are making serotonin, or you grow bacteria that make dopamine, and then your brain is
on fire. Yes. Yeah. And as a psychiatrist, I can share this, that none of the psychiatric medications have actually been extensively studied in children. There are no neuroimaging studies of the brain to see what are the neuroanatomical or other kind of changes that these medications are causing. And there are no long-term studies to see when a child is exposed to these medications, what happens to their brain on the one hand and what happens to the rest of the body on the other. We have some information about antipsychotics that I think within 10 years, so if a child is 5 and you put them on any antipsychotics, risperidol, and even the newer generation ones, the Abilify and the Seroquel and Latuda, which are thought of as not causing metabolic syndrome, but what we see is that by the time these children are 15, 16, they're developing type 2 diabetes.
Yeah,
So,
and I study the gut a lot, and I do know that hormone changes can also occur when your microbiome isn't good, not
Yes.
just the brain changes. And what I'm seeing in my population is that women are developing things like PCOS, which like they convert their estrogen to testosterone when things aren't metabolically right and they have blood sugar issues. And then the boys are the opposite. They convert their estrogen, their testosterone to estrogen.
Yes.
I was talking to my son about this because he gained 20 pounds really fast, and I started getting worried about him. And I said, if you eat too much sugar,
They're gonna
you're gonna change your hormones. And he said, really? And I said, yeah, if you eat too much sugar, your testosterone is gonna turn into estrogen. He freaked out on me. He's like, I'm never eating sugar again. And I was like, it's not that bad, but don't overdo it.
In moderation, and where is the source coming from, and a lot of. So I'm going to ask you a really, really tough question, and this is tough because you have a wealth of knowledge and information, but for the sake of our viewers, and I want you to condense that into 3 pearls of wisdom for overall health, but specifically focused on brain health.
Okay, 3 pearls of wisdom. I would say, number 1, listen to your gut.
Very
listen
important.
to your intuition, because I think that like the mistakes, if you think about life and the mistakes that you've made, it's usually because you didn't listen to yourself.
Yes.
And so, number 1, have confidence in yourself and have confidence in what you believe and follow your heart. Okay, maybe follow your heart, number 1.
Yes. Agreed.
Number 2, let food be your medicine. So,
Agreed.
diet.
Yes.
I think environment, diet. So I always talk about clean up the environment, clean up the diet. Don't put things in your body or around your body or in your body, I say, that don't come from God.
Yeah.
It's kind of a simple way of thinking about it.
Absolutely.
So if you can't pronounce it and it doesn't come from God, think twice about it.
Okay, good.
And so those are 2 pearls of wisdom. And 3 is maybe pay attention to what's happening in your gut. Because I think your immune system is in your gut. And so working on your gut, healing your gut will help heal your brain.
Absolutely. And again, and this is where I think you and I connected, because you were coming at it from your own experiences and education and all that. And me as a psychiatrist, I made my own transition for many reasons, very similar to yours. And I came at it from functional medicine and Ayurveda, and there was a perfect amalgamation of our thought process and very similar ways that we heal our patients.
Yes.
The gut-brain axis. That's what.
And that's what MAPS is also about.
Yes.
Because it's a group of individuals who have kind of are thinking about these types of things in very similar ways, and how we help heal our patients. And in the process of healing our patients, we help heal our families. In the process of healing our families, we help heal ourselves.
And our communities, the larger community. I mean, everything that what I'm hearing that's happening here in the lectures that I've attended so far, it not only has, from my perspective, it not only has an immediate value, but I can see the value of this education having a ripple effect well into the future. So coming to that, what do you think is the trajectory for MAPS? What is, as a founding member, what are your hopes for MAPS?
I think the idea of MAPS for me now, I mean, it started with Defeat Autism Now in the late 90s, and then now it's MAPS. Our goal was education. Education, and to educate families, but now with MAPS is to educate doctors and clinicians to
Yes.
understand how to treat the body holistically and to look at underlying metabolic and comorbid conditions that we can easily treat that help solve other issues. So they
Yes.
help solve mental illness issues, they help solve GI issues, they help solve immune issues.
Yes. Yeah. Okay. And then want to talk about this book that I have. So this book, the title is Writers Without a Voice, and the author is Rajan Agrawal, who is Dr. Usman's son. And I will let Dr. Usman talk about this book. What is this book about?
So I've been working with children on the autism spectrum since 1997. And over the years I have patients who, even though they're improving, they still are non-speaking. And some of them wrote very beautiful poetry, write very beautiful poetry and very deep. So if you met them on the street or you came across them, you would not realize how much they have to offer and how much knowledge and insight they have. So Rajan put together a book called Writers Without a Voice, and it's a book of poems written by non-speaking individuals. And so it's available on Amazon, and there's a website too. And so if you're interested, it's called Writers Without a Voice.
This is such an amazing project. Thank you to Rajan for putting this together.
You're welcome.
Thank you for your
Yeah.
time. Yes, yeah. It was really my pleasure talking to you, and I have a lot to learn from you. Looking forward to that.
Thank you. Thank you for having me.
Yeah.
Thanks, everybody.